Thank you. And as the ranking member of the tax subcommittee here on Ways and Means, I hope that we can take a moment to put the cost of not only of Medicare for All, but other costs that have been proposed as well, to put that in the appropriate context, as we know that the efforts to raise taxes on all Americans, including middle-class Americans, to pay for new federal benefits. As many of you know, we started in February with a proposal to increase the Social Security taxes. That proposal would increase the tax burden, for example, for a single mother making $50,000 per year by $1,200 annually. Then that was followed by a hearing on infrastructure needs that also proposed an increase in the gas tax. After that, we had a hearing on paid family leave, which would also raise that same single mom's taxes by about $1,450 per year and provide a benefit that she would unlikely use if she would be running her own business. The following week, we had a hearing on climate change. That proposal would cost between $51 and $93 trillion over 10 years. Even at the most conservative estimate, $51 trillion works out to more than $15,000 per American per year over the next decade. And now we are meeting to discuss this proposal, Medicare for All, representing another tax increase of roughly $10,000 per year that each American is going to have to pay. As a representative of one of the most rural districts in America, I'm very concerned about the impact that any proposal would have here out of Congress. Now, we know that Medicare for All represents a $32 trillion expenditure to the federal budget, and it also represents an immense risk for rural providers. Under the proposal, a single unelected bureaucrat acting as regional director would be given broad authority to negotiate payment amounts for all healthcare providers in its region. These payments, capped at an arbitrarily determined capacity to provide care, would be prohibited from being used by hospitals for capital expenditures to improve patient care. These are very important topics across rural America, especially rural Nebraska. Rural hospitals, we know, are already struggling today, and we see uncompensated care because of high deductibles, high co-pays that is impacting so many. Since 2010, more than 100 rural hospitals have closed their doors, and many rural hospitals are operating in the red. And yet one estimate regarding Medicare for All projects a 40% payment reduction for these hospitals. It was discussed earlier. This proposal would exacerbate the current healthcare provider shortage we see in rural communities, and I truly believe that rural America deserves better. Ms. Turner, can you explain how a single-payer system would impact rural Americans and the rural hospitals that serve them?
I think rural hospitals would be much like vulnerable patients. They would be those who struggle the hardest. Most of them could not tolerate 40% cuts in their non-government compensation right now. Many, even more, would close than are closing now, and it would significantly impact the access to care. Also, physicians finding it very hard to keep their doors open. People in rural communities have to drive 100 miles sometimes to see a doctor, a specialist in particular. I think those problems would be exacerbated as we lose more and more physicians.
Right, thank you. And just in closing, I hope that we can have discussions about reducing the cost of health care before we actually implement drastic new changes to how we pay for health care. And I think we can have a very, very thoughtful discussion and exchange of ideas as we might proceed. Thank you, I yield.
Thank the gentleman.